Okay, hello everyone. I'm Dr. Kim and welcome to the YouTube channel for the Neobiotech. And as we mentioned before, today we're going to share the knowledge and experiences about sinus lateral bone graft, which is specifically by SLA kit. I've been using SLA kit for 10 years, more than 10 years so far. Okay, so I think it is a good chance to share or experiences from the weird cases as well. Okay, so most of our unique concept for sinus surgery is minimally invasive sinus surgery, which is well known from Dr. He's concept. And well, in this book, we summarized all the concepts for minimally invasive sinus graft surgery. So now I'm going to start with the case from Dr. He. Actually, this is not my case. This is courtesy of Dr. He, and which is written in this book as well. Okay, so this patient needs some implant for the posteriors. But as you see here, on the right side posterior, so the posterior maxilla, the maxillary tuberosity is elongated to down to the lower. So we don't have that much space for the upper teeth. So after a while, Dr. He did sinus graft with a simple vertical incision, and he made lateral sinus opening window with the SLA limber, which is included in SLA kit. Then he dissected sinus membrane and he grafted bone. I think most of the time he used the alloplastic bone graft for this patient. Okay, so this is radiograph. As you see, already opaque on the sinus of right side, posterior. Okay, so after a while he placed here and there. Now you can see after he put the lower teeth, how much space we have. We don't have that much space on the posterior here, right? So this is the picture at the surgery. As you see, he removed the bone. He removed the cortical bone from the up. Then he placed the implant, and he did some terrifying biopsy. And this is how it looked after implant placement. And this is a histologic view of grafted bone. As you see, alloplastic bone is black, and new bone is pink, is surrounding the alloplastic material. So this is a radiograph after implant placement on the right upper side. So if you see this, these two posterior implants are not placed in the residual bone because he removed it, right? So, for creating space. So after that, he did the final restoration for this case. So isn't it amazing that we can place implant and load implant at the grafted bone only because we removed the residual bone, right? Okay, so let me show you about strategy for sinus graft, what I have for now. Okay, so if you have a thin bone, we definitely gonna need the lateral approach for sinus graft for implant placement, either simultaneously or staged approach, right? But if you have about 6 to 8 millimeter bone, and if you want to place 10 millimeter implant, what you gonna do? So you may need to have lateral approach for this case, right? But let's change the thinking to when we do the lateral approach, sinus graft. Okay, so if you have a 6 and 8, but if you're planning to place 8.5 implant, what you're gonna do? Then it's gonna be covered with the crestal approach. Maybe simpler than do the lateral approach, right? So when you decide 10 millimeter or 8.5 millimeter, it depends on the situation, right? You have to think about the crown implant ratio and the space to the antagonist as well. But you have to think about this. Better to be long and has to be wider. Okay. Also, you can change the treatment plan from the lateral approach to crestal approach. Maybe you can reduce the surgical morbidity as well. Still, I still mentioned that we have to think about the space, what we have, right? Okay, so when I do the multiple implant, right, then I'll do the lateral approach, then crestal approach. If I have to do the single, I think about crestal approach first before I do anything. Okay, so this is what I have. This is strategy what I have. For the single maxillary posterior missing, so last maxillary posterior missing, I always look at the lower first to see if we need tooth, then I'm gonna go for the implant. But if there is only space for half tooth, then I'll think about not doing the implant placement. So you have to check the occlusion, right? And also you have to think about the distal buccal root angulation as well. So also, if you have like a distal buccal root is too distal, then you may need to place implant distally, then it creates the medial cantilever as well. So that's not good for the mechanical point of view, right? So in those cases, I don't usually do the last molar replacing with the implant. Okay, so which instrument are you going to use for the sinus graft? Okay, it's better to use the famous one, right? But still, there is no magic wand, right? You have to get used to it, and you have to understand mechanics of those instruments. It's better to have less invasive instrument, and also you have to think about use something easy to clean, right? Okay. So advantage of using those kits, easy to set up the operation room, and you can standardize the treatment, and easy to learn, and less chance to have problem during the implant placement or sinus graft. Okay, and my assistants are loving it, and I'm loving it too. Okay, but when you think about the sinus lateral approach, it's going to be very stressful, right? You may need to worry about what's going to use, and edema, and swelling, and bleeding, and perforation, and septa as well, right? And I like to use the SLA kit and LS lemur, right? So it always creates the thin cortical bone, and which is very safer during the treatment because you have thin bone plates on top of the membranes that make you feel much better, right? So this works like this. And also have a stopper, right? So it's not gonna go in too deep as well. So this is the picture with the LS lemur, the window when you made, right? So we have different length of the different heights and different width of the drill, right? So you can choose, depends on the thickness of the anterior lateral wall, and you can create the window safely without tearing the membrane, right? Okay, so where you're gonna open the window, right? So in this case, we recommend to do like medial as possible, okay? Also, we have to think about most anterior and inferior. So if you make window too high, then you have to go down, and you have more chance to perforate the membrane. That's why we recommend to make a window at most anterior and inferior area when you desire to do the sinus graft or implant placement. Okay, so this is another one, C-lemur, which acts very similar with the trap fine drill. Okay, if you love to take out the core, then you use the C-lemur, and I like more the LS lemur because it leaves thin cortical plates that make safer during the suction or like when you dissect the membrane. Okay, so when you do the sinus graft, you have to do the membrane dissection, right? We call it freer elevator, F-R-E-E-R, means you make membrane free, right? It acts different with the curette, right? Curette, you have to digging out, right? So you have to pull action to your body to remove the granulation tissues or anything. But with the freer, you have to push. It's a big difference, right? So you cannot pull it down, you have to push it out. But when it touches, when you push out, the end of the tip of this instrument has to touch the bone, okay? So this is how it works. So freer elevator, you push out, right? And the end of the tip has to touch the bone itself. If not, you may have tear during the dissection using the free air elevator. In the SLA kit, there are 3 free air elevators. So number 1 and number 2 and number 3. So with the number 1, it's laser marked. So number 1, you dissect medial and distal buccal wall. Like this. And number 2, there are 2 parts, rectangular and the wider part. Okay, so first time you use the rectangular part of number 2 free air elevator. So it means you go down, right? So you go down from the window what you open, then go down to the crestal, right? So this is how it works. And after you finish number 2, the rectangular part, then use the wider part to move far. Okay, so this is very important, the tip that you have, right? So after that, when you meet the septa, and if you want to go to the medial, then you change it to the number 3. So it's double twisted, like a twicely twisted flare. So you do it like this. Then after that, you do the bone graft first before you place implant. Then you can place implant. And there are another drill, a C-guide drill, which will give you easily positioned the lemur, right? So it makes you target on the anterior lateral wall. Then you can use LS lemur or C lemur to remove the cortical bone, to creating the window on the anterior lateral wall. Okay? So like this. Okay, so from now on, I'm going to show you the clinical case, real case of one of my patients, right? He needs a dental implant on the left posterior. And as you see here, there are not much bone for the implant placement. So definitely we're going to do some bone graft, right? So lateral sinus bone graft. So I make it a little faster. I made it encoded a little faster. So this is the movie clip while I'm doing the making incision. So I made a crestal incision here, and I made one vertical incision on the front tooth, right? The number 24. So I'm gonna move a little faster. So when I dissect like this, as you see here, there are some bony spicle here, right? So I removed it. Now I'm using the LS lemur, and I don't do I don't go crazy. Like I'm going little by little. So I do little by little. So once I adapted it and rotate it, then I check there are bleedings or openings. Okay, so still not opened, right? So I go a little more. As you see, you can see the drop, right? Drop of the lemur. Now it's open, right? So you can see the thin cortical plate from the LS lemur, and it's moving with the curette, right? Now I have number 1 free air elevator to do the distal and the medial dissection. Okay, so I do the medial and the distal dissection first with number 1 free air elevator. So what's next? So next will be number 2, right? Still I'm using number 1 free air elevator. So now I have number 2. You see this rectangular part, I go down from the window to the crestal part. Yeah, my hands covers, right? Okay, so once I finish with number 2, and I'm using the other side to go further. right? So now I'm touching the crystal part of the maxilla with finish number 2. As you see, with the patient, you can see the movement of the membrane and the cortical plates from the LS lemur. So now I'm using number 3, Fourier elevator, to go the far distal and the anterior part. So once I finish the dissection, then I put the bone graft, and I'm using the number 2 Fourier elevator as well to push in the bone graft to the distal first. Okay, so once I finish distal, then I move to the medial anterior part, then I finish with the middle part. Okay, once you finish with the middle part, then it's not going to go into the anterior, medial part. So that's why I like to do distal first, fill the bone distally, and medially, then I go to the middle part. And this time I use the FDBA and the alloplastic material about the same amount. Okay. So this is how I fill the bone graft on the sinus area. So I do I repeat this bone graft procedure, and I use the LS lemur. Then I place implant like this. Then I cover the window with the PRF membrane. It's not has to be, and then I close the wound like this. So this is immediately after the sinus graft, and you see the window opening on the anterior lateral wall, and this is a CT cuts of the surgery. You see the fill the bone around the implant. So I decided not to place the implant number 26. I'm going to place it later on. Okay, so this is immediately after the sinus graft and implant placement on number 25, right? So then after 6 months, I placed number 26. This is how it looked. I waited for a while and I finished the restoration for this patient. Okay, so how do you like it? So it doesn't look too difficult, right? So you have to follow the steps, like using the LS lemur carefully, and you don't go like in one shot. You go little by little, checking. Then once you have an opening, then use Fourier elevator 1 for the medial and distal, number 2 for go down and go far, and number 3 for anterior and the medial, right? Then you do the bone graft, then you can place implant. Like this. Okay, so here we have another case, and actually this patient was referred from one of my colleagues. Okay, and this patient already have sinus graft for the right side upper, right? Then my colleague had found the perforation during the sinus graft. Then he stopped and waiting for a few months. Then he referred this patient for sinus graft on the right side, right? Well, as you see here, this patient has to go for the implant for the left upper as well. Okay, so this is the panorama CT scan. As you see, here is the opening, right? Like this. So this sinus, like a light anterior lateral wall, has the opening, the window from the previous surgery, right? So this is how, this is a clinical picture after I dissected the periosteum. And you see the periosteum and maxillary sinus membrane are sticking together, okay? Like this. And this is after a clinical picture after I dissect the sinus membrane and do the bone graft, right? So after that, I covered with the PRF membrane for the anterior opening, anterior lateral opening. So let's see another movie. So my colleague didn't put anything between the maxillary sinus opening and the maxillary sinus membrane. So it means periosteum and the sinus membrane are sticking together. So you have to dissect it, right? So if you want to separate the sinus membrane and the periosteum, then you're going to have big problem, right? So you're going to have some opening of sinus membrane, the tearing of sinus membrane. So you have to go above. So you have dissected the muscle, not the periosteum. So I'm going to show you how it works. Okay, so this is the incision part. Okay, so once I made the incision, okay, so here you see the attachments, you have like a scars, right? Then I'm using number 15 C blade to dissect the between muscle and the periosteum. So you go little by little, right? I'm going very slow. Once you dissect it a little, then, well, I have to use a blade another time. Very carefully to separate not between the periosteum and the sinus membrane, between the muscle and the periosteum. So one layer above, right? So you leave the periosteum on the anterior wall. So this is very careful procedure, right? You don't want to have sinus membrane tearing again, right? And believe me, you have to have enough time to do this. Then, now I separate the sinus periosteum and the muscle. Now you can see the previous window, previous opening from the previous sinus graft, right? So I do same. I use the Freer elevator number 1, 2, 3, right? So here I have number 1. A little bit above, then medial and distal, right? Now I'm using number 2 to go down, right? So from number 2, you can go from a window to the crestal part. So I do I'm not using pulling down. I do push out, and the tip of the instrument has to touch the bone, right? Then I'm using wider part of number 2. Like this. And now I have number 3, right? To go further and to go down more. So once I finish with these freer parts, then I'm ready for the bone graft, and I found there's no perforation of the membrane, right? Then I place the bone graft in the syringe. I carry it to the syringe, and I'm using the Freer elevator to pack the bone underneath of the membrane to the crestal area where we want to have a graft, right? So I do very carefully. I'm using Freer elevator to locate the bone graft, and as I told you before, I do distal first, then I go medial, then I put in the middle part. Okay, so this is what I do. Okay, so repeating the bone graft procedures like this. Then I cover with the PRF membrane, the anterior opening. And this case is, I haven't created the window. The window is already there. Window was already there. So I covered with the PRF membrane because it was too big, right? Then I placed the PRF membrane. Then I cover, I made a sutures to close the wound. So this is how it worked. Okay, so this is revisit the maxillary sinus graft case, right? So here's you can see the bone graft on the right side. And here is the CT scan after the sinus graft, after second sinus graft, right? Then this is how it looked afterwards, and waited, and I did the lateral approach for this left side as well. Okay, then we placed the implant like this. Okay, so with the SLA kit, you can do like most of sinus graft like this. You have to be familiar with using FreeAir elevator and LS lemurs. By the way, you're gonna get used to, right? Then you can do the sinus graft without stress, right? Okay, so here is another case. This patient needs some bone graft and sinus graft for the left maxilla, left posterior maxilla, right? But here you see the heaviness on the left posterior maxilla, right? The left maxillary sinus. From the CT scan, you can see the membrane swelling, right? So you can have thickening, you can see the thickening of sinus membrane on the left side. So I told her to go to the ENT doctor, and she had a medication for like a couple of months. Then she came back. As you see, there is no membrane thickening anymore, right? But still, the problem is here you can see the opening, right? So opening of crestal part, right? So this membrane thickening, I think this is from like an odontogenic origin, right? So here you can see the opening and the crestal area. This is clinical picture. As you see the redness on the crestal area, maybe about like a number 27 area, right? So you can see the redness here. When I opened the flap, I intentionally extended my incision to the palatal side, okay? So I found the opening, and also I found the perforation of the membrane. So now what you're gonna do? So what I did was I made a window on the area of number 26, and then I dissected membrane. So including the tearing part, right? So I dissected membrane, I placed the cola tape through the crestal opening on number 27 area to cover the tearing part. Then I did the bone graft. I did the bone graft not from the laterally, I did the bone graft like a crestal part. So I made the lateral window. So I did the bone graft not from the lateral window. I made a lateral window to dissect the tearing membrane, right? And I did the bone graft on the crestal area, from the crestal opening. Okay, so here you can see the bone fill, right? And I covered the crestal opening with the PRF membrane, and I closed the suture like this. And this is the periapical radiographs of this patient after the bone graft. I did the lateral approach here, and I did the crestal approach here, right? So here where the opening was. So I waited and a few months, and this is how it looked after a few months. Then this is the time of re-entry, right? As you see, there was no redness anymore. Then this is how it looked after wound opening for implant placement. And I placed 2 implants like this at the site that I did the graft. Then I did the implant placement, and this is how it looked in the periapical radiograph, like this. And this is cut of CT scan. Also, from the CT scan, you can see the bone graft around the implant, right? And again, this is the periapical pictures from implant placement, uncovery, impression making, and final restoration. Okay, so this is a clinical picture of healing abutment after second surgery. Here you see there is not much space, right? So I decided to do number 37 crown again, to replace number 37 to create the space. So this is final restoration on the cast, and the final restoration panoramic radiograph after final restoration, like this. Well, so if you have a perforation, you have to, consider it exposed and dissected not from the crestal, because you have crestal opening already, right? So in those cases, you can use lateral approach to help to dissect the membrane and the crestal, tearing of crestal area. Well, this is my last case today, right? So time goes very fast, and it's already been more than 30 minutes. Okay, so here, this patient need to extract number 25 and number 27, 3-unit fixed partial denture, because patient had fracture on number 25, and also you can see the periapical lesion on number 27. As you see here, this part is very thin cortical bone left, as a pneumatized, right? Well, I removed the tooth, number 25 and number 27, right? Now I need to place implant, but as you see here, here is a septa, right here, and you see there are different looms, right? So this septum divided two different parts. So this part have a little of a bone, but this part have less of bone on the crestal area, from the crestal area. So what I decide to do is I'm gonna do the crestal approach for this front implant, and I'm gonna do the lateral approach for this posterior implant. Okay, so this is a radiograph to see I'm using the SLA and do the bone graft from the crestal. And because of the septa, right? So it's very well containing defect. So you can easily do the bone graft through the crestal for this area. But posterior, there are not much of bone, so I decided to go for the lateral approach to fill the bone until the septa, right? So this is a clinical picture like this. This is number 25 implant site that I did a sinus graft for the crestal, from the crestal approach. And here you can see my window by the LS lemur for posterior implant for the lateral approach. Okay. So here I dissected membrane like the same fashion that I show you on the movie clip. And I did a bone graft, right? Like this, and I placed implant. Then I cover it with the sutures. Well, I haven't placed implant for number 27. I'm gonna place it later. But this way, you can use crestal and the lateral mix and match together. They easily make a sinus bone graft in different situation, right? So this is a CT scan of before and after. This is before, and this is afterwards. Okay, so this is a panoramic radiograph after a few months. So, well, I don't know. Is it helpful for yourself to do the sinus lateral approach? And I'm using SCA and SLA more than 10 years now. I feel I'm very satisfied with this instrument, and I don't using any other instrument for sinus graft. Still, these days even they have a kit called the old kit, sinus old kit, which include the SCA and SLA all together. So when I have a sinus surgery, I always tell my assistant I'm gonna need SCA or SCA or sinus old kit, right? So those three kits, you don't have to have those three. Either you can have the SCA and SLA or sinus old kit, right? But those kits saves my time a lot. And also it's good for my assistant. After surgery, they don't have to spend too much time to cleaning those instruments and reset up the instruments. Okay, but still, I also know that these are not magic wand. Okay, you need to understand the mechanics, and you have to get used to with this instrument, right? So I believe these tools works for you, and if you understand what it is. Okay, so try to use the SLA, and SCA for the sinus graft, what you have for next visit. Okay, so thank you very much for joining us, and thank you very much to being with me for today. Okay, so that was my last slide. Thank you.